thing you know, they're in a nursing home, they go beyond that 90 days, longer stay, and the carriers immediately will be notifying DHS to put them on the Medicaid traditional program. That doesn't happen as often as we thought it would. It doesn't happen as often. Or you might have a situation where they go home after a rehab, that's all covered under DHB, they go home, and then they need some home and community-based waiver services. They'll be calling DHS, because some of those waiver services may not be covered under the DHBs. Again, you know, those are the situations that this would come under.
Don't we also get, just, I know we're in a little bit of a rabbit trail here, but just so we're all talking the same sheet of music, private plans have many more tools at their disposal. For example, they can say your deductible will now be a much higher number instead of a much lower number. That's one way to manage how much I'm increasing your monthly premium. Number two, I can do things like networks, and I can adjust co-pays, and I can make all kinds of plan changes to absorb some of these impacts. Whereas in this government program, when we ask Washington if they'll allow us to do those things, the answer is, you know, frankly, not much. Really, the only tool that exists is an increase in rates. And then finally, we really haven't seen any evidence that private plan rate increases are more or less in Arkansas or nationally than the government plan increases, at least that I've seen. So, but the ability to change the plan elements, make your deductible 1,000, 2,000, 5,000, 10,000 is a huge difference between the plans.
Okay, Representative Ferrari, recognized.
I think a lot of the answer may be, you know, a private insurance plan after a 2-year period, they go into Medicare. So when they're being disabled, then they're not on the private plan anymore, they're on the Medicare system. So they only have to take care of that, private insurance will have to take care of that for 2 years. That may be, just a thought.
I don't know, Max, I know we didn't, does anyone want to speak to that from the insurance industry at all about this? You don't have to, but.
I mean, I'll be happy to try and answer your questions, Senator.
Okay, would you mind coming up, because again, I know this is an issue that has got a lot of people concerned. Yeah, right. But before, while she's coming, though, Senator Chesterfield, you've got a question, you recognize.
Is it a matter of changing the 10 essentials? Did we define what our 10 essentials were?
No, that's part of
That's a part of the feds.
Yeah.
The feds determine the 10 essentials. The insurance companies do have the right to say, we feel that these people should go over, but they have not reported, what 147?
138.
138 have gone over. You said that there were several that have been denied.
9.
None. So.
I think it was 130 requested, and of those 9 have been denied.
Denied. So they're not actually asking for relief.
Correct.
And I'm not sure it's because they don't know. I get the distinct feeling they probably know they can. If that's the case, why then, Madam Insurance Person, have we asked for more if it is causing a huge increase in the cost of your coverage?
If you, Max, you just identify yourself. I think there may be a couple of questions, and I know, again, we didn't give you time to prepare for this.
I'm Max Greenwood with Arkansas Blue Cross and Blue Shield. Senator, if I understand your question, it's why we haven't asked for
More persons to be put into regular Medicaid as opposed to operating under the private option if there is indeed the medically frail issue to deal with.
Well, as John pointed out, the memorandum of understanding that carriers have with the state of Arkansas defines medically frail as those individuals who need services that private carriers do not provide. Long-term care is one, home health would be another, but there are many legislators who believe that medically frail is tied to a specific dollar amount. I think that's where some of the confusion occurs, and it is not. So, for example, we have a lot of high-cost individuals, Hep C would be an example.
But they're not medically frail.
That is correct.
Mhm.
They do not need services that we do not provide under the 10 essential health benefits. So that would be the reason why we have not referred more individuals to the state with regard to Medicaid federal. Those individuals also have to approve being returned back to traditional Medicaid, as do their providers. That is the other element of someone transitioning back to the medically frail traditional Medicaid program.
One of the issues under the Affordable Care Act is that no longer would catastrophic illness be capped, because so many people were going bankrupt because they could not pay for the illnesses, because you could cap it at $10,000, that's all we're gonna pay you. Now there is no cap on that. Is that not a driver as well?
That's correct.
Thank you.
Maxie, I appreciate your willingness to take some questions here. Because again,